Good afternoon, I'm Dr. Peacock. This morning I'm going to show you a patient that had chronic ulcerations under the second metatarsal and the fifth metatarsal of her right foot. This patient is a working patient. She's employed and she's a diabetic, and these ulcerations can be limb threatening. Now, this particular lecture is basically geared towards what podiatrist's role is in healing these ulcers. As podiatrists, we treat patients with ulcers, and we're also trained in not only surgical corrections, but also how the foot actually functions and how it works. So we're one of the best doctors to go to if you have an ulcer. Now this patient is on North Carolina Medicaid. It's very important that Medicaid keeps podiatry in the loop of the Medicaid providers. The reason for this particular type of ulcer, if it's treated with debridements or with total contact casting, those type of modalities, they do work, but the ulcers return at least 80% of the time. And a lot of those treatments are extremely expensive. We can treat this ulcer and get an 80% long-term heal rate by performing tendon rebalance, and these procedures can actually be performed in the office instead of having to go to the hospital. A typical surgery like this performed in the hospital will cost over $12,000. For her to go through wound healing clinics and to use biologics would be even upwards to $50,000 to $60,000. If she were to have an amputation for this, that gets into the couple $100,000 expense for our insurance companies. Whereas we can perform Achilles tendon lengthening on this patient in the appropriate patient, and the patient will have long-term healing, and that can be done under local anesthetic in the office and can be done for less than $600. So $600 compared to $12,000 in the hospital, or up to $50,000 with wound healing modalities, or up to over $200,000 for amputations. Now we have to remember that amputations are important because when patients have amputations, their life expectancies diminish drastically. Matter of fact, many of them do not live after 5 years after an amputation. And so it's very important that we heal these ulcers and get these people back to work and back to their normal life. Imagine being a patient walking around with this, the odor that this produces, the having to constantly battle this, having to go back and forth to a clinic to get debridements and modalities, when this can be corrected fairly quickly in the office under local anesthetic. That is the role that podiatrists play in the diabetic population. One of the many roles. We're going to show you a patient where we corrected ulcers on a long-term basis. We did this using MIS surgery under local anesthetic. An Achilles tendon lengthening procedure was performed to correct the equinus deformity. Many studies show that 90% of diabetics have equinus. This biomechanical deformity is the cause of most diabetic foot ulcers. By correcting this biomechanical deformity, long-term healing success is seen. This is backed by extensive research. Podiatrists are surgically trained to perform procedures that correct biomechanical deformities. Podiatrists understand the biomechanics of the foot and how this leads to chronic ulcers. Their role is vital in wound care. You will see this in the presentation as it follows. They can lead to long-term care with wound care clinics and large amounts of payments out for wound care products. And really these types of ulcers are most of the time biomechanical. To correct these ulcers, now she's only a few months after the surgery, and she's now even back to work with her ulcerations. So what we did with her, we actually did a percutaneous Achilles tendon lengthening. If you look at her foot here, you can barely see the incision. One small incision here and one small incision here. And this allows us to lengthen the posterior muscle group. A lot of the etiology of ulcerations in the forefoot for diabetics has to do with the fact that they can't bend their foot, their ankle, 10 degrees. See, when we're in normal gait, if you look at my leg here, in normal gait, when we stand forward and we go to area we need to push off, we have to have 10 degrees motion in the ankle because our tibia goes forward 10 degrees. So if you don't have that movement, you'll get excessive pressure in the forefoot or you'll toe walk. So that's why most diabetics get forefoot ulcers. As a matter of fact, substantial research shows that as many as 90% of all diabetic patients have a tight posterior group, which we call gastroc equinus. Now she had a gastroc soleus equinus, she had both the tendons were tight. So this is why these ulcers went away. Without this, she would have very likely had to quit work. She would have most likely had to go through lots of surgeries with her foot and even amputation of her foot. So now she's probably not going to get the ulcer again. This corrected the biomechanical issue she had. So let's ask the patient. Now, we know that you're one of our patients on the Carolina Access rolls and all that. What do you think would have happened if you couldn't have seen us as podiatrists? What would have happened to your foot? Yeah,
I feel like I would have lost my foot eventually.
Yeah.
I'm not able to pay for it.
Right. So she would not have been able to pay for this treatment if she didn't have access to podiatry. And if she would have lost her foot, that would have been an amputation. That would have cost hundreds of thousands of dollars to the state of North Carolina because she eventually would have had to go back into the Medicaid roll. Now these types of surgeries are performed by podiatrists. We're the ones that do these surgeries. We understand the foot biomechanics. We understand the reason why people have ulcers. And the research now clearly indicates and clearly demonstrates that most of these ulcers in the forefoot can be treated with biomechanical correction of the foot itself without going into extensive, costly treatment protocols at substantial reduced payments for the insurance companies. This includes Medicaid. Another thing is podiatrists, we can do many of our surgeries in the office, which is a lot more cost effective than going to centers where there's a lot more payment out. So this can actually be done in the office for less than $400, whereas if you go to the hospital, that visit could be up to $12,000. So substantial reduced payments for Medicare, Medicaid, and all the other plans that we use. But more importantly, we're the ones that can treat the patient. We're the ones that know what to do for this. Most other fields that deal with ulcers, they don't understand the biomechanics of the foot and do not know when to do these procedures. So we're very vital to our patients here in North Carolina who are on Medicaid. We need to stay on Medicaid. It's very important, not just for us, but for the health of our patients. Now you can see that we've got our foot healed. I want the patient to tell you, our senators, our representatives, and the people that control some of these interests in our patient health care system here. How important do you think it is that podiatrists stay on Medicaid and in these insurance rolls?
I think it's important for y'all to stay because nobody wants to lose any of lose their feet, because without our feet, we ain't able to do nothing.
Right. So the patient, that's about the best way you can put it. Without your feet, you can't do anything. Your feet are important. Well, the podiatrists are the most trained at foot issues, especially when it comes to alterations and things that patients have like that in diabetic patients. We're the ones that take care of these patients, and we're the ones that try to do the most with limb salvage and have techniques that can be performed in the office setting for prices that are much less and economically better and better for the patient as well.